I'm a physical therapist, and I'm going to tell you why physical therapy may not work for sciatica, plus what to do instead. For people who don't know, sciatica means pain in your back, buttock, or down the back of your leg along the course of the sciatic nerve. Now, the sciatic nerve is made up from the L4, L5, S1, and S2 nerve roots in your lower back. Then it runs through your buttock underneath a muscle known as the piriformis, and then it goes down the back of your leg. And one common reason why physical therapy may not work for sciatica is just because of that very thing that can be caused by so many different issues. If you're treating piriformis syndrome, pinching of the sciatic nerve in your buttock, but the problem is coming from the lower back, then obviously it's not going to work. And if you're treating a pinched nerve in the lower back, but the nerve is being pinched in your buttock, again, it's probably not going to work. Furthermore, to compound that, there are other things that can have symptoms similar to sciatica, such as joints in the lower back, your SI joint or sacroiliac joint, or even muscles in your hip that can cause that referred pain into your buttock or leg that are called sciatica, even though you may not have a true sciatica. So one main reason why physical therapy may not work for sciatica is either a misdiagnosis or not understanding where that symptom of sciatica is coming from in the first place. Now, what are some other reasons why physical therapy might not work for sciatica? Well, if you ask physical therapists, they might say, well, the patient was non-compliant with their exercises. They weren't doing their exercises. For the purpose of this video, I'm going to assume that you are doing your exercises, you're doing everything your physical therapist asks, and for some reason it still may not work. But just keep in mind that if you are having physical therapy for sciatica, you do need to actually do the exercises to make them work. But one main reason people don't do their exercises is because they don't feel like they're getting any better from them. Now, why might people not feel like they're getting better from doing exercises for sciatica? Well, if you ask an orthopedic surgeon, they may say, well, there's a herniated disc, or there's spinal stenosis, or they have arthritis. It's just a problem that physical therapy can't help. And there are cases where things are severe enough that they do need surgery. But largely, those are the vast minority of the cases, meaning that most cases of sciatica can be helped conservatively without surgery. But what do you do if you have the correct diagnosis, you're doing your exercises as prescribed, you're doing the right exercises, and your problem isn't severe enough to warrant surgery? Why else might physical therapy not work for sciatica? I think probably the main reason why physical therapy doesn't work for sciatica in some cases is underdosing. And I don't mean you're not doing necessarily enough repetitions of your exercises, but rather think about how little you do your exercises during the course of the day, even if you're doing them as prescribed. Let's say you go to physical therapy even 2 or 3 times per week for an hour, and you do your exercises every single day for an hour. Well, there are 23 other hours in the course of the day, and what you do those other 23 hours vastly overwhelms what you do during the 1 hour that you're exercising. But if you can understand why you're doing the exercises in the first place and apply that principle throughout the course of your day, you have a much better chance of getting better. So next, let's go through what to do to get your sciatica to go away. Remember, your sciatic nerve can be pinched either at the nerve roots in the lower back or in your buttock, which means from a movement perspective, usually it's either movements of the back or movements of the hip that either cause or alleviate sciatica symptoms. If we're talking about the lower back, usually it's either backward bending movements that aggravate it or forward bending movements that aggravate it, or sometimes side to side movements, particularly if you only have sciatica on one side or down one leg. Now, for people who have more sciatica pain when they're standing or walking, this is typically middle-aged to older people, then extension or backward bending is typically the thing that aggravates sciatica. Now, if you stand with a lot of arch in your lower back, or you sit without back support where your spine is actually arched even though you're sitting, then those things can put your spine in a position of extension. And if you're doing that all day long, then that irritates the sciatic nerve, puts it in extension positions, even if you're doing flexion exercises such as pulling one knee up to your chest or pulling both knees up to your chest or doing an all fours stretch like that. And in fact, if those things make your back feel better for a little while, you probably do have more of an extension related problem. So if you do have an extension related problem where your sciatica symptoms are worse when you're standing or when you're walking, then here's what to do. Spend more of your day in flexion type positions. One easy way to do that is thinking about rolling your pelvis underneath like this so it flattens your lower back. When you're in a lot of arch like this, you're in more of an extension position. When you're in a pelvic tilt like this, it takes you out of some of that extension and puts you back in more of a neutral position. Now let's consider the other problem. What if you have sciatica more when you're bending forwards or when you're sitting for long periods of time? In those cases, you may have more of a flexion type of problem. Additionally, if you do exercises like press-ups like this, and that makes your sciatica feel better, or if you do backward bending exercises like that, and that makes your sciatica feel better, or if when you're standing or walking, your symptoms go away. Those would all confirm that you have more of a flexion or forward bending type of sciatica. And in that case, you want to increase the arch in your lower back or spend more time in extension. That may mean sitting with a towel roll or a pillow or lumbar support in your lower back when you're sitting for long periods of time or taking trips in the car. That may mean standing up more often when you are sitting for long periods of the day and doing backward bending type of exercises. It may mean that when you're bending forward that you don't round out so much at the lower back, but rather that you keep your lower back more arched as you push your hips backwards. Those are all ways to incorporate more extension activities into the course of your day if you have a flexion or forward bending sensitive sciatica type problem. Now, if you have a side to side type sciatica problem, again, this is usually symptoms that are only on one side, and it may happen if you're leaning more towards one side, or if you always tend to stand with your weight more on one hip, or if you always tend to carry a heavy bag or purse over one shoulder. Those are all things that can cause side bending type sciatica problems. And in those cases, you really just want to focus more on being more symmetrical throughout the course of the day. So not sitting on one side. If you're someone who tends to sit with one leg tucked underneath, that's probably something not to do. If you notice that you always tend to stand on one leg, or if you're carrying a child around on one hip all day, that can cause more of a sciatica problem. So it's more paying attention to keeping things symmetrical from left to right. Now, what about sciatica problems at the hip? For example, if you have a compressed sciatic nerve in your hip, that can come from the piriformis being either too short or the piriformis being too lengthened. Now, one common thing that people do for sciatica type pain is stretching their piriformis, often doing exercises like this. And in some cases, that is good if you do have a stiff, short piriformis on the side that you have the symptoms on. In other cases, that may not be a good idea. But one test to do is try crossing your leg over like this, see how far you can get down, and then do the same thing on the opposite side. And if you notice a big side-to-side difference where one side doesn't go down as far as the other, you probably want to stretch the stiffer side. That doesn't matter whether that's your symptomatic side or not. So if you can't get your symptomatic side down as far as your non-symptomatic side, then it's probably a good idea to stretch it. However, if you can get your symptomatic side down even farther than your non-symptomatic side, then you probably don't want to stretch the sore side. You may actually want to stretch the non-sore side instead. If you have more flexibility on your symptomatic side, that's probably a problem where the piriformis is lengthened. And every time you go to take a step on that leg, your piriformis gets stretched over the sciatic nerve because it's lengthened and weak. And in that case, you want to Strengthen your hip muscles on the sore side so that you're not overstretching that muscle every time you put your weight on one leg. One of the best ways to do that is to practice standing on one leg, trying to keep your belt level. This often helps to do this standing in front of the mirror, but standing on one leg, trying to keep your belt line level without letting it drop down to the side like that. Now, to bring that into everyday function, when you do go to take a step on your sore leg, think about squeezing and activating your buttock muscles every time you put pressure on that sore leg. That'll help activate your gluteal muscles and keep you from dropping down and overstretching the piriformis over the sciatic nerve. That's also a good idea because often your gluteal muscles can cause symptoms that are similar to sciatica. In fact, the gluteus medius and the gluteus minimus can refer pain down the outside of the leg, and those are often mistaken for sciatica. So hopefully you found this video helpful to understand why physical therapy may not have been helping your sciatica, plus give you some ideas on what to do to help it. Now, if you'd like more tips to relieve sciatica, check out our back pain and sciatica relief playlist right over here. Before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.